Malaki ke whakau ai o pani ke alope he palasi se lope tonga mano i e kolope o auto i uinisa la wala ko anga e tupe Ela hopo pelenite, kuhulu I polatane. He palokisai kua movete, pakamau o tarite. O whaie teke, siwangi la tonga, he okutu, kai koma. Kakua hoko o iloa Kangita loa Sai tonga hihiko Te hopalala Te kamesi Koi pai ana e whakaua Fio ai e kakala Ka tumu aki o mohere o po Yo nenga ngatu I e hoto O tuula I e ka e mangalo E la hopo o peleni te Ulu I pola kane E palokisa I kua moveke Pakamau o e karite Siwangi o tonga E okutu Koi koma Kakua hoko o iloa He sika he Mahiri o ne angi He ue ia He kakala He mausa o pagini nami Kapai silupe E nai te oe o tu tereni E oku taku E whetau Rangi maa o palakaisi E la hopo o peleni te Ulu I polatane E palokisa I kua movete Pakamau o tarite O whaie teke Silangi o tonga E okutu E koi koma Kakua hoko o iloa E la hopo pelenite Uhulu I polatane E palokisa I kua movete Pakamau o tarite O whaie teke Silangi a tonga E okutu Koi koma Kakua hoko o iloa E okutu E koi koma Kakua hoko o iloa
Welcome to Voice of South Pacific, broadcast from the Amo City, Seattle, Washington. So glad that we finally have our last program here with Christina Predict. This is the communication specialist from the King County, Seattle King County Public Health. We've been working with Christina Predict, for almost like 2 years. And coming today, we don't want to say goodbye, but today is Wednesday, Thursday, September 15, 2022. Again, we're so fortunate to have time to work with the Seattle King County Public Health, especially with all the representative, all the staff, and those, who were working so hard to be on the front line during the pandemic with the COVID-19. There are so many communicable diseases. And we're so glad and thanks to our Heavenly Father for bringing us together all the way up to these days. Although we may not see everybody else, but we're still glad, that we could see each other, still talking to each other. We have Christina Bredick from the Seattle King County Public Health, a communication specialist that have been helping our Voice of South Pacific to spread the word to our Pacific Islanders community. And also the big supportive too from our project manager, Silly Kalepo. Yeah. And also we have our radio engineer, Neta Tua Tapealava. My name is Sylvia Taimi Aho, and we also have Saini Pulokatatola. Welcome, Christina. We know this is not a good day for us to say goodbye, but we're so fortunate to have some time to work with you and also have some time to have our last conversation today. And may not be the last time, but we'll continue on regardless where you are. We will still follow you. Hi, Christina.
Hello.
Malo ki mo ake hokatu ki whawhiloa ke pe koe tahai ni oi whewhine na toko ni lahi au pito koe whawhawhonga me Seattle King County Public Health o ne toko ni I Apollo Kalamani ke mau ke lava o hoko atu a whakahoko whatongia ma ai community tonga pe he whoki ki he Pasifiki pe me Seattle, Washington, America. Hi, Christina. Sorry for taking your time, but I just wanted to make sure that some of our people from our Tongan audience or Tongan listeners. Christina. Hello, Christina. Welcome
Hello.
back to the Voice of South Pacific.
Thank you so much for having me. And I've just really appreciated all the time over the past couple of years, having this opportunity to speak with you, all of the wonderful questions from the community that you've shared. And I'm definitely going to miss being on here. So with sincere thanks for the past 2 years, and definitely difficult to say goodbye, but you're in good hands. There's so many fantastic people at Public Health Seattle and King County, including Sealy. So I leave with confidence that you'll still be in great hands and have everything you need.
Thank you. As you're about to leave, what is something that you wanted to leave with us that is very important to keep us safe and secure as you're about to leave the Seattle, Washington?
Yeah, I think the thing that is on my heart the most, that I think is very important for people to realize, is one, as you said, we are so fortunate about where we are right now and this place in the pandemic. We are seeing cases that are lower. They've plateaued since May. And we are seeing the effects of precautions such as masking in crowded spaces and being vaccinated and being boosted take effect. And that's fantastic news, because we are in such a much better place than we were 2 years ago. But I also really want people to realize that COVID-19 is still here, and it's still a fairly new disease. In King County, we see about 10 hospitalizations a day from COVID-19. And we still see, unfortunately, probably about 15 deaths a week from COVID-19. And it's estimated in King County tens of thousands, possibly hundreds of thousands of people are experiencing the effects of long COVID. And we're seeing more and more studies come out. So I think it's really good to return to normal with caution, keeping things in mind. And just because we're lifting, just because there aren't as many restrictions and more things are open, COVID-19 is still here. So I would just share with everybody to still be vigilant, put a lot of care towards elders and people who are immunocompromised, and just, yeah, use the knowledge you have as you go forward.
I'm gonna have Saini just interpret it, for our listeners. Just short.
Ia hau ek makai ngā whakatapu atuheni pe mahu whanga te whakatapu o at me wharen ko I kai lava pe o whakahoko atu hako ngā si o e whamatala ko ia polokalama I he whakatai whiaf koe ni. Hange koe ni o si lawe at kia sirivia ko whiwhine whoki eni na e tokoni lahi taha mai I he tau e ua koe ni ko tau toksi toa me ai I he taimi koe ni e toa e mahak whakaauha koe ni ko COVID taha hiva. Aia koe whiwhinene une o mai koe kono tuunga koe ofisa maalunga ia o whitutaki. Me he pot ngawe koe ia mo ui a King County Public Health. Ka koe ni au hike atia o ngawe ke hike atia ngawe ke LA. Ka koe polkalama whakaosia ni mo ia e koe ni whakamalo mai pe ke at ki tau tolu I he tau tokoni. He kohi o ilo ia o holo au pito e ngahi cases koe ia o e COVID koe ni ho tau county koe ni o King County. Pe au ku ne ilo I ko hi ko mui me talango fua e kakai o tau hi ngai whakaehi ehi mo ngahi whakahino hino mo ngai whare ina o mai mea tiki nau tolu. Ka I he taim ta tau pe ko eke whakai sirivia ko haha ngai whare I tene whai mai pe a toki hiki atu e ke ngai fo ou. O ne whakamanatu mai pe ke tau te toka ngange pe. Neongo pe o ku holo ki lale u keisi ka au fie maa uia ke tau toka ngange I he whakaehi ehi tau te whita mea whika aku me kau vai kai pe he ke kakai o punau. Pai peho nao ngahi alanga maha ki hango whakatapu, tauhi ko uhi ke oa te nao toi hoko ki nao tolu o whaingata a ia, ka pau te nao puke I he COVID taha hiva. Thank you, Christina.
Hi, Christina. You can go ahead and share, some of the things that some of the things that is very important, for you as you're about to leave. What is something that you can leave with us, as to remind us, what's very important for the community to continue on?
Yeah, I think what's very important to know is that there's new booster shots available. So hopefully everybody has gotten their primary series of the vaccine and received their first shot and then a follow-up shot. And then boosters provide the best protection. And now we have a new booster. So this booster is really helpful because you've probably heard about Omicron, and Omicron is very contagious. So we know that for the very first COVID-19, it had a high rate of being contagious. So for every one person who had it, they would likely affect 3 people. And this is very high in terms of how viruses go. With Omicron, that number is up to 15. So every person with Omicron tends to affect 15 other people. So it's very contagious. And the vaccines that we have provide protection against severe illness, but are based on the first strain of COVID-19. So now that COVID-19 has changed and we've seen a lot of variants, there's a booster shot to help provide protection against those variants. And that booster is now available. You may hear it called the updated booster or the bivariant booster. And everybody over 12 years old is eligible if it's been 3 months or longer since they've received their COVID-19 shot, their first shot, or a different booster.
translation here. So must you have a regular booster before you can get this updated, Omicron booster?
That's a great question. No. So if you only had your first vaccine series, which is 2 shots,
Yes.
but never had a booster, you can still get this booster.
Oh, thank you. Thank you. So I will include that in this new
And
piece.
then just one thing, you cannot get the Omicron only. So you do have to have the first vaccine series,
Yes.
and then you're eligible for the booster.
Thank you. Io, hange koe mo mea ihe ne whamatala mai. Koe whehu whang nei whai kei, pe koe hape hanga hi mea ne toi pou mai, ke ihi koe ne polokalama whuke nei whai mai o tau wahe o whare I mai koe ni e mea me pot ngai mo ui. Koe ne whamanatu mai pe, koe whonga lelei taha pe ko ia o malu I koe me he COVID-19. Neongo ke ai hono ngahi whahinga kalasi kehe pe koe whahinga
Koia.
fōtunga kehe, whāriunga o mahaki koe ni. Koe pau ke ai ho huhu. Ai a ko uruaki huhu koe ua. Huhu uruaki, koe huhu hoani, pe a hoko ki ai moho booster. Pe a koe whehu ina e koe mea na ne whakamanatu mai, wai whake booster fo ou he tai mini. O kai ke uhinga eke ke toi ai koe ha booster uruaki, pe a tok te ai huhu koe booster ua. Sai au pito pea. O se peha ongo huhu awe ua, lava lewa ai koe booster koe ne Omicron. Ai a koe ni whamanatu mai manatui, koe whāriunga ia koe ni koe whotunga ia o COVID koe ni he tai mini, koe Omicron, o ku hanga whatapu, o ku pipihi lahi ang au pito ia. Koe COVID uloaki, na ke panaeta hana e puke, lava toi puke e toko tolu. Koe nia, koe puke koe ni he kalasi koe ni Omicron, lava puke e toko tahani make. Ai mahu inga au pito ke tau whakaehi pe kai ngata ai, lava atu rewa whai ho huhu. Ai ongo huhu koe uloaki, huhu hoani, ai rewa moho booster. Malo. Thank you.
Welcome. Thank you. If people are looking to get a booster, they can go to kingcounty.gov/vaccine, and you can find locations as well as events that are happening in the community if you don't want to go to a vaccine center. And there's places that are providing boosters at community events, and the calendar is on that page. One place that's very easy to get it is the Auburn Outlet Collection. You can walk in there, there's a clinic, and the boosters are available. And most pharmacies have them now as well. Just like with the first COVID-19 vaccine, these boosters are free. They're safe, and you're eligible regardless of insurance or immigration status.
Koe na ni hanga whamatala atu, ai booster koe ke Omicron. Oku mawat pea I he uwheitu ke he mahalo ke os mea I pe koe uwheitu u. Koe tahanga I wheitu ma u whaingofu ai, o ke ai pe ai
Pharmacy.
loki heni I he Auburn Outlet Collection. O mawai a peni pe koe ngai pharmacy, pe koe ngai clinic, pe koe na koe maheni alu ki ai. A koe mea mahi ngata hafo koe ngai huhu koe ni oku free, oku tae totongi pe ia. He ko hi o totongi pe he pure anga ke mau e hataha pe, I ha whainga taimi pe, kai ke lau ia pe waha o insiua, kai ke lau ia pe kuke nofa whanua hen pe I kai punga mea whaka immigration. O free katoa pe ia ke hataha pe o whia ratu ke mau ai huhu koe ni. Thanks, Christina.
You're welcome. And one question we also get a lot is when people hear new, they tend to get nervous or scared about the booster or the vaccine. These vaccines are the exact same technology as the original vaccines, which means they do not contain any virus. They just speak to the cells in the body, and in about 3 days, the enzymes in your body have broken down the vaccine, and there's no longer any evidence of it except immunity. So this is an updated mRNA shot. And what we've seen is that they are very, very safe and effective.
Takai uloaki koe o uhuhu, O kui kai fo ke iai ha sie muia heni o ngawe aki ke whaito o koe o me he mea huhu koe whai ake huhu. Kai opita ke ha sie muia ai ni koe o kou viti pe ko hawhainga sie mu o hawhainga mahaki. Koe mea koe ni koe whaito o pe ke malu i koe. Pe kai ke ngata ai ke manatui. Koe whai aha pe tolu o kuno whai e whaito o iho sino. Koe ni ospea ku osia. Ko toi e ki tua. Kai kia hano whaingataa, kai kia hano whaingataa maki e hoko kia te koe. Pe kai ke ngata ai, koe mea pe o kunofo koe ia koe, koe iwi malu i koe ia o e whaito o, te ria na a whaiwhai ka ke mau e maha ki, pe a ka pau rewa whaianku ke puke, o ku ikai ke puke lahi, o ku whaingofua pe rewa e mea kotoa pe ko hiko sia e whaito o malu i ho sino. Thank you.
You're welcome. And one last question we get a lot this time of year is if you can get the flu vaccine and the Omicron booster at the same time. And the answer is yes. I had mine. They did one in each arm so that those shots do not interfere with each other and it is safe. And I know I did not have any big side effects or anything from getting them both. And that's the same with your child as well. So if your child is older than 12 and getting back to school shots, they can get the Omicron booster and the flu vaccine. If your child is under 12 and is getting vaccinated, there's no problem. They can get multiple shots together for back to school.
Tui hankon koe mātu a kapag o atu kaure kā ki nau polokalamba huhu whakateim te pile pe koe whakatatau ko nau tau. Kapau o nau ihi lalo hifo nau tau i he tau tahawa. Hoko at pe nau ngahi huhu koe a nau tau whakateim te pile hangi pe koe kuke o smau e kono teim te pile pe ki hoki pepe o lere hake aga o ki he tau tahawa. Kapau lewa o ova he tau tahawa. O motu aangi hono tau he tau tahawa. Whaka ofa alu pe koe o ma ko koe a take kaure ka mo koe an kono ku lakanau tau he tau tahawa. Mo wo fai ho mo flu vaccine, I regular flu vaccine pe koe ne huhu malu I whaka tau. Ai a fuk whawhai sepitema o ka topa. Koe fuk te teu e momoko ki whai tau flu. Pea lava le rewa pe o whai atua I mo booster koe o Omicron. Lava pe ne talamai na e tok alu ni a huhu. Na ai huhu takitaha honongo uma. Kai kia ha neongo I puke pe whai ngata a ia pe koha mea taha te neongo I. Koe ki mamahi pe koe a mata I huhu I hono uma. Ka koe ia pe. Lava atlewa whai ho huhu whakatau koe he ki mua pe ho koe ai tau flu. Pe lava I lewa pe mo huhu Omicron ho booster. Thank you.
We know that a lot of people have also been hearing about monkeypox.
Yes.
And may have questions. So if you'd like, I can share a little bit about what we know with the current outbreak.
Right.
So monkeypox is not a new disease, but it's showing up in countries where we don't normally see it. So this current outbreak has been in many countries in Europe and is in the United States. In King County, we've seen a little over 600 cases, and the rates are going down, but it's definitely still with us and is a disease we're seeing more of than we have before. I know there's a lot of questions about what monkeypox is and how it spreads. So monkeypox spreads through very close contact. So it's different than COVID, which spreads really easily. Monkeypox is through close contact. So that can be hugging, very close face-to-face contact. It can be sexual intercourse, holding hands, sharing drinks or utensils or things like that. And the most telltale sign of monkeypox is a rash. And when somebody has this rash, that's when they're most contagious. And that's what is going to spread the monkeypox disease, kind of the liquid that is held in those rashes. So the most important thing to do is check for rashes that may be new or that you're not sure what they are. it can look very different. So any questions at all, it's good to go and go to a physician and ask them to see if it's a normal rash, if it's an allergy, or if it could be something like monkeypox. So if you have a rash or someone in your household has a rash, cover that up with gauze or making sure they're wearing long sleeve shirts to limit exposure. And then just if you're with a lot of people you don't know, just limiting things such as close face-to-face contact or number of sexual partners.
Pe whoke ne whakamatala ko ne pehe koe whoke ngai whehu I pe hange koe kalas fo o koe ne o hoko mai I he tō mahaki ko mea koe ne o koe monkeypox. Aia koe whehu I lahi taha e kakai nau pehe koe hae whonga o te lava o mau pe lava pipihi mai maha koe ni kia te kita. Ko ne whamatala o ne pehe koe monkeypox ia o ku kai ke pipihi ia hange koe COVID. O pehe ko te ofi pe ke tako ia. Ko monkeypox ia o toki pipihi pe ia, o toki lava pe ia o mau, ia taha o ku te wheohi, whemiri sino mo ia wā ofi. Hange ka pau te wha ufua he tako ia, pe o ku te uma ke he tako ia. Pe koe ngahi mea koe wā ofi au pito whemiri ai sino, koe mea e koe e lava mau ngofua ai. Pe ko e te hange ka pau te inu me hei putatau, pe koe hina vai tatau, pe koe hange koe u huhu mo here. Aia ko mea pau ke tau mai ki hoto sino. Aia ko ne whamatala o ku tokanga pe mua whai au pito pe whai ehi. Pe koe whonga o loaki koe unau, whonga maheni unau lava tala aki, whai longa aki a mahaki koe ni. Koe kula ai kiri. Koe te seo kia hinge koe kula ai kiri. Koe hinge pe na e veri ka hangea koe kula hange koe na e baku. Aia o asi pe parewa o asi e mea pehe pe ufi rewa ko hike o e toi ufi ka pau te tuiha falani pe koha kofu ni maloloa pe ko ke ufi me ka pe kai ke ngatai fok fa fetu takrewa ke togeta o fa matala ki ai ko hike lava rewa o fai ha sibi aia ko u mak fo ko ni ana ka mata mai pe me Europe u feitu ko ya ka ko ni ko sia o mai ni ki amerikani pe pehe u ki ai case o ko wono nge au tupu pe aku ale taimia mo ni ki alu hifo pe ki lalo ka koe te fito I me ape uni whakamatala mai ke tokanga pe ai whaka ehi ehi au pito pe koe uhuhu koe no ton ke o whai huhu malui lava atu rewa o whai uhuhu ko ia te ria ai ke hao pe mo uirerei pe ho a koe pe mo family foki. Thank you.
You're welcome. And if somebody wants to know more about monkeypox, or if they're eligible for a monkeypox vaccine, which are available for people who are at high risk, they can go to kingcounty.gov/monkeypox and find out all of the information, as well as some numbers for clinics they can visit if they are worried they might have monkeypox or that they've been exposed.
Whainga whamatala whakaiki ki ange te lava pia maa watu pe mehe website koe na King County. Aia o ku whamatala atu ai whaunga koe te lava maa ai huhu. Malu I koe ke monkeypox. Ka koe taimini ko nau tolu pe o nau lava ke maa huhu koe ni, whai toko koe ni. A ki nau tolu pe koe o ki ai ho nau ngahi maha ki tauhi hanga whakatapu. Pe koe kakai matu o tua, koe tau kau tau reke reka. Aia koe kakai pe wala tuu lavea ngofua, o whekau aki pe moe mahaki pipihi koe ni tau whai tala noa ki ai. Aia mawat pe ia I he website koe na King County, a koe kingcounty.gov monkeypox, e lava lewa mawat e ngai whamatala ko ia mei ai. Thanks, Christina.
Thank you. Those are all of the big things that are happening or that people should be paying attention to right now. But if there are any other questions, I am happy to answer them.
Yeah, just have a quick question about the monkeypox. Like the rash and all those the monkeypox rash and starts on the face and spread to the body. Is there is a particular area in the body that's most likely to be easy to be catched by the monkeypox?
There is not. And what we'll find is monkeypox. Previously, you would hear a lot of hands and feet and arms. But what we're seeing with this outbreak is there's not one area where you see them more than others, and they can be anywhere on the body. So from your face and your hands to more intimate areas to the bottoms of your feet. So that is what we're seeing. The rash looks different on everybody, or it might start different, and it can be in different places. Mhm.
Is there anything else that, like, most likely in the past, after each of the spread virus, there's always something coming up because we started from the COVID-19 and we go from there to the Omicron to the Delta variant, and then from there to the monkeypox. Is there anything most likely that there is a talking about any new virus, or it's kind of nice that it's all the medicine are taking care of all those germs and viruses that's spreading?
Yeah, I saw a very interesting statement recently that I think is true, and sometimes we don't always remember it, but the statement was, "This is the virus's world and we are living in it." So just to say that viruses exist, they've always existed. And you're right, through medicines and vaccines and taking precautions, we can control them, but they're here. And the goal of the virus is to infect humans so it can continue to live on. So I think that's something that is always good to keep in mind. I'll go through the different, so for COVID-19, right now, the Omicron variants, BA4 and BA5, are the most dominant. This is what we're seeing, and this is what the new booster protects against. So, and I want to remind everybody that variants occur because every time the vaccine or the virus, every time the virus passes from person to person, it might change a little. And when it changes enough, that's when we have a new variant, and that could be more difficult for the body to recognize as COVID. So the more you can stop the virus from spreading person to person, the better shape we'll be in, and the less likelihood there will be more variants. And social distancing is still incredibly effective in just maintaining your space indoors. If it's very crowded with no ventilation, you can still wear a mask. They're an excellent tool. If you're inside, keep windows open, and things like that. So even these small precautions can really help, as well as getting vaccinated and getting your booster. Monkeypox and COVID-19 are not related. They are different viruses. And it's hard to say why a virus appears again all of a sudden or why it becomes stronger. But we're watching monkeypox very closely, and most people are not at risk for monkeypox. And monkeypox has a very low fatality rate. So most people who get monkeypox survive monkeypox. It is just very uncomfortable. And for 2 to 4 months, or 2 to 4 weeks, somebody can be sick with the disease, which means they can't work. They'll have to limit their social interactions, and that can be very difficult, as well as very uncomfortable and painful. And then I know I'm giving you a lot, Saini. Okay. And then I'll let you translate and then I'll talk about one last thing.
Ai koe nei hanga o whamanatu mai, manatu I koe monkeypox ia mo COVID-19, koe ongo siam kehe pe ia.
Yeah.
Koe ongo siam kehe pe ia, pe aku koe ngahi whaunga kehe pe whukeni, hangi koe kina lawe ki ai, e whaunga koe mauai. Ka koe mea lerei taha pe whukia ke lawa atu koe o whai ho huhu malui. Whai rewa huhu malui, ai koe ngau huhu e ua ulaki huhu hoani, pe ai rewa moe booster. Pe hangi whukoni koe ne whamatala mai whiawhini, lawa rewa mau atu whuk moe booster koe ke Omicron. Ke mau hawhu I booster taha. Ka pau koe booster koe ke mau ke Omicron, o se lawa mau atu me he ngahi kliniki, mo ngahi pharmacy, mo ngahi whetu ke poko mau, pa koe manatu I whoke o kai ke totongi, o free ka atoa pen. Kai ke ngata pe, o kai ke nau eke na tope ko hau insiwa, pa kai ke ngata ai, o kai ke eke immigration status, kai ke hane kau ngai taha ki ai. Mahu inga pe ke lava ato mau I huhu, koe ke lava malu I koe, pe kai ke ngata whoko koe pe ka ki ho family. Ai ka pau whoko awhenga maari e pe ia, tui pe koe mask. Tui e mask ai mea koe ku malu ia ko fofonga, moho ngutu, moho ihu. Tui e mask he ufeitu koe ke au kia tau te fito ka pau rewa ko ufeitu koe ni, o tokolahi ai kakai, ta tau pe poko tu a poko whare. Koe ke tui e mask he koe malu I lerei taha pea koe ke tui e mask I ho lava ke ufeitu koe ia. Thank you, Christina.
You're welcome.
Christina, it's about like 6:40 right now. I'll ask Netta, like just a 30-second of playing a little melodious music all the way from the South Seas. A little islands breeze. Tau ki kolosi he ki he South Pacific Tonga, ki hawiri mai mea I haki fo hiwa me he ngahi matatahi ko ia whawhai Pacific.
Lale mari e mai, matangi taurua. Tanganoa ke masani, mo se tia suva. Torewa ke uoko, o whakaola uma. He luma ki gati, asi o tole kua. Mo e manatu, o whakatua. Ta whesi oi mai, e oi harapuna. Ta sami peni fie fia, kosi e te koula. Agesia opa, opu kei talamuka. Liti o sasana, ai ongo otia. Tapai e pouli, ako no kasauhina. Tua hoe na pitonga, one fetuia. Ie vai e sono, mata onu sima. Kai mele I uotanga, sino ia te kita.
Thank you, Christina. We know that in about a week or so, we heard that you're going to leave us. Can you tell us what will be your next chapter of the type of work that you're going to provide?
Thank you. I've received an incredible opportunity from the Los Angeles Department of Public Health, working with their policy and epidemiology teams. So very excited to be doing those things, even though there's many people in King County that I will miss, and it's a hard place to leave. Yes. I think yeah.
Congratulations.
Thank
And
you
as
so
Celie
much.
said, several, including us, of course, we don't want to see you go, but that's a great opportunity for you and best of wishes from us here.
Thank you so much.
Ia, ko tō tāna whena maungawe mai e ni tau e ua pa mo ne pōpō. Lai o me ngai whanga Māori ke toko ni mai e King County ki he whamawhalarea ai Pacific Tonga. Pea ko iai, ko ni ko tatau mai tene hoko at lewa mi he Seattle King County Public Health ki Los Angeles County Public Health. So when are you most likely to start on your new job over there?
Yeah, it'll just be a couple weeks now.
Oh,
Wow.
So later this month, I'll
Ended
be
soon.
starting there.
yeah, yeah.
Well, regardless, we don't want to say goodbye, but I know it's exciting, to go to a new place, new environment,
Yes.
and it's a big, huge city, and you're going to deal with all the, celebrity over there in Los Angeles. Yeah.
I don't think possibly, very possible.
There is a lot of Pacific Islanders,
Yes.
big, huge Pacific Islanders. But Los Angeles, it's a big, big, huge city. It's spread out. The people live all over from Riverside, Pomona, Anaheim, Santa Ana, Long Beach,
Everywhere.
Inglewood, Hoffman, everywhere, and also to the valley. So, but maybe when the next time we come over there, we'll hopefully get to see you. 'Cause I'm sure you're gonna like the sunshine.
Yes.
Yeah.
Warmer than most of the time.
Seni?
Ia, koe whakarea whakien ke whiwhine koe nia, koe whamatalata siriwea nei, whiwhine to koni lahi au pito mai ke polokalama koe ni. Koe ana ne ofisa whetu utaki, pia koe whina ne whakahoko mai, ngahi to koni lahi au pito, whakahino hino, ngai whaunga kehe kehe, pia nā ne whakawhainga Māori hono taimi, ha whainga taimi pe, te mawhia maa uai ha to koni. Neonga o kai koe nesia pe koe toke tā, ka koe ofisa whetu utaki whopa, nei o si ai pe hona ngahi training whakawhai to'o, to koni lahi au pito mai ke polokalama koe ni. So, with our listeners here, Christina, we are wishing you the best of time as you transition from Seattle here, King County, to LA County. And best of wishes. And of course, if we might need something, we would be welcome to call or touch base with you. But of course, we are in very good hands. We have Celie with us, so as several others in that department who are going to continue to support and work with us on these health issues. Thank you.
Thank you, Christina, and best to you.
Thank you so much. Thank you for everything. Sylvia and Sani, it's amazing to be on with you, and it's a fantastic show. And also to Netta for all your behind the scenes work, and Celie, who I work with closely, and you'll definitely be in good hands.
Yes.
Yes.
Indeed. Yes.
Thank you, Christina.
Thank you. Have a good night.
Thank you.
Stay in touch. Thank you. And best to you.
Tahiti ei taku, koe society, koe kau kau tope, koe mau
Well, welcome to our King County Project Manager, Siri Kalepo. As like what we heard from Christina, we're still in a good hands. We have another captain to continue driving us.
Yes.
Thank you, Celie, for all the work that you have done. And regardless, saying farewell to best Christina, but we know that you'll continue to be our guiding light, for our Pacific Islanders, program here on the Voice of South Pacific broadcast. Celie, What would be the latest updates that you wanted to share with our Pacific Islanders listeners?
Yeah, for sure. Thanks for having me on. I just wanted to talk about continuing our Islander talks. We've kind of taken a little break. I mean, we had an amazing conversation with Netta Sella and Pastor Ofalangi on our last call. So we're really wanting to follow up on that. Also, stay pretty connected with a lot of the COVID cases and with monkeypox coming up, and then with the new boosters. So we're trying to find a fine balance of updates for the community relative to updates with community conversations, because they're getting a lot of them getting heavy and deep. I know the Samoan community wants to come on and talk about housing stability, but Lupe had a family crisis that came up, so we had to reschedule that. And working with Tanyela in the Fijian community, they wanted to explore abuse and how to identify abuse, how to report abuse. I know that's one of the big topics in the Fijian community. And then also with the Marshallese community, talking to Cece, there's actually a big monkeypox outbreak in South King County with Marshallese families. So I think on the next call with the Marshallese folks, we want to really bring in somebody from the CD Epi team to talk about dispelling myths about monkeypox and how to keep the community safe. So as we look out for as the year ends, we really want to go from an Islander talk focus and then King County public health updates. So I think that's kind of the pattern we're going to try to follow with the with the rest of the year, looking at October, November, December. So yeah, that's just kind of the update I want to bring up, and then I have to work with Netta to figure out what the next Tongan topic is that we want to explore and take a deeper dive into.
Thank you, Silly. I think those are great topics, like especially dealing with our younger generations, nowadays, because sometimes the parents can try their best, but there could be like a little missing link that will affect, the younger generation. And we wanted to make sure, that they are safe and not influenced, by wrong directions, and also to, I think that something that I would look at too, especially with the younger parents, that maybe that we could have a program, in the upcoming future, that we could try to empower them, to, encourage them of things, that they can, like feed into the generation, the younger one, especially growing up, the kids, and then up to the middle age, and then to the high school level, it's just like, that saying, uh, you know, first the school is start from home. Everything start from home. And
Mm.
I like, like when you're talking about the housing with Lupe, housing assistance. Yeah, those are a great topic that a lot of people always called, looking for that, you know, um, like housing assistance, that a lot of our people need that part. And because, city very well, how we lived, it's like maybe four families in one household. Because sometimes not only that to save money, but it's just like our families, Pacific Islanders families live as a communal, they like to hang out together. And then sometimes they find out, they don't really have space for themselves. And then they, especially the elderlies, and then they wanted to find a place to live, but it's so hard sometimes to struggle to get those resources, So those are good programs that you're looking at, to bring it on. And also, I think that's one of the things too, the people, that wanted to, the undocumented, if there's a way that maybe you can check it out, Silly, what are ways that maybe to find resources, to help those people that have been living here for many years, the undocumented. Second thing of how people that wanted to become a citizen, to help them and assist them, to get their, uh, you know, become a citizen.
No, that's good. No, I actually talked to a person that was referred, a Samoan man who lives here from Western Samoa, but which I mean, for folks know that American Samoa is a U.S. territory, so most folks who live there were U.S. nationals, where Western, I think, was a British colony, and those folks have green cards. But I was speaking to a Samoan man the other day who wanted to figure out a process on how to be a citizen. But it's no different than any other undocumented person who's trying to be a citizen in the United States. It's just a process. But yeah, that could be one of the many topics. And then, as you mentioned, housing stability affecting everyone with the the rates of inflation going up,
Yes.
Oh,
and
yes.
as intergenerational households are, you
Yes.
know, housing is getting too small and folks are trying to get out. So yeah, we're just trying to combat that, because if we don't, then there's just going to be a lot of islander families experiencing homelessness. So
Yes.
a
Yes,
lot of
especially
captivating topics to explore.
right. And like in SeaTac, that's where I live at. Almost the average, like the average house right now for renting, even like from two-bedroom, start with, it's already goes up to, no less than $3,000,
Hmm.
like in SeaTac. Not only that, but ladies and gentlemen, for those of you that are listening, it's not everywhere, but because SeaTac, it's the location. They're everywhere, right across from the airport and next to the freeway, next to the shopping mall. So there is just the location. They're very centralized and very close to everything. And so maybe that's one of the thing. That's why it's so expensive. But otherwise, that's just the way, if regardless of the price and how expensive it is, it's almost everywhere. But sometimes it's worth it, instead of staying far away, you're spending more time on the road. They already do a study and they do a survey on that. Finding out it's not always good, to go live far away, because you'll end up, especially with the Pacific Islanders, you go to a family function, you go to a church function, you go to a gatherings, you're spending more time, you go to work, you're spending more time on the street, take 3 months out of the year to sit on the street, driving around, so it's very wise. Thank you, Saini. Thank you, Silly.
Yeah, for sure.
Io hange koe koe whamatala koe na siri o kune tala mai e lava peo o tokoni maha te ngahi polo kalama kehe. O tau te whita whoka nge koe lau koe ni ki he totongi koe ne rent pe koe mortgage o fu mamafa au pita whokia i hawhainga wheitu pe. Whake ahalau e ki loto siato. Ka koe te ngahi tawhatafa aki pe kau kia ia a CTEC hange koe na lau kia Silvia mo ngahi wheitu pe o fu mamafa tu totongi lahi au pito ai totongo ia o nofo anga. Pe koe loki taha, pe koe loki ua o swai pehe lau afe, ai mamafa au pito. Ai tala mai e siri, lava toko ni mai hawhenga polo kalama. Pe he foki pe lava toko ni mai hawhenga polo kalama whekau aku me umea whaka immigration. Hange koe kalaska unau fie whaere sitseni, pe kalasa uteke maa e nau green cardi. E lava whakatutu mai hangai polo kalama ke toko ni mai ai hana whakahino hino, mo ngai whaunga ko ia, he ilo na ki whaingo fua ange. Ai taimi ko whae kore ke u ngofua peheni. Thank you, Silly.
Yeah, no, I think I will end with this. That I mean, I think the long-term vision of the Office of Equity and Community Partnership, that's where I work here at Public Health, is to, as COVID is, slowly dissipating and we're learning to live with it, we're just trying to address those social determinants of health that island communities are facing. The external health factors that are determining our health outcomes. So as we continue to unpack those in deeper dives and continue to update the community on relevant like county updates, I mean, I think that's kind of our goal for the next 3 months. And then hopefully, as we stabilize this can be a staple of King County and we can continue to fund this program and have these relevant updates.
Thank you very much, Silly. Good to hear. And thank you for the great work you're doing there in our partnership with King County. And with our communities, not only just for the Tongans here, but also for our listeners, the South Pacific Island population here in King County. So, malo aupito sili ofatu aupito ketekoi. Thank you for your part, and thank you also for the listeners who are we trust pay attention and take notes. And as Silly said, he will work on this programming as part of his equity partnership efforts from the King County end to assist us with all these needs, such as the immigration, housing, and of course with the King County public health issues such as COVID, monkeypox, Omicron, and etc. Thank you. Malo Opito.
Thank you, Silly. And just one last thing, I just wanted to add on. If you know any other resources, the head of the government of Tonga is coming in on the first week of October, our Tongan Prime Minister, and he will be here for 2 days. If you know any other resources, he likes to meet with some of our government leaders, and I'm sure just like how the Samoan leaders, when they come here to the country. He's visiting, to some other states, and also he's heading out to our nation's capital in Washington, D.C. But, these are some of the things, that we can add on since you working with the King County, if you know any other connections, that we could add on, that would be, he likes to visit, or let us know. Thank you so much, Silly.
Silly, we will let you know the details because we'd love to have you as part of our community to meet the Prime Minister, because you are a source of strength and assistance to us folks.
Absolutely.
Here. So we'll give you the details. We'll give you a call to see if you can set aside some time while he's here. Thank you.
Thank you so much, Silly. Have a great weekend. Thank you for everything. Malo. Tama Samoa. Tofa soifua. Exactly, this is 7 o'clock. Ko ia ka inga tonga mo me mai o ko whai pe teu ko ni mau teu mo whai ai te waki ai teu ki me mai ai tangata ik pare mea o tonga i he wike uloaki ko ia o katopa. Wike ulaki ko ia o katopa te mau toki tuku atu ai aho mo tai me i he wike kahau. Polo kalama ko ia tu site o wiki kahau, te mautoki o ato ai whakaikiki. Pea kai ki ngata whoki ai, ko mou toi mau pia mou tai, mou alpe ki i uti, po si o ai, ki e anga ko ia ai whaka apa i ko ia e pitania, ai la a koto Queen Elizabeth Siwa, ai a ko ene halaini i hono, tau hi wangofulu maono. Pena iai whakani whelawe lahi, mo e la a ko unga whanua, Queen Charlotte tupo tolu. Pea osko ia hokoto ai kia King Whaahau tupo wha. Pea awat kia tupo nima. Koe whale o ha moe o fo. Koe tu i e tolu. Koe tu i koe kuini. Pea moe tu i e ua. Pea koe ni koe au mai ni ka tupo wono. Ma whanongo pe foki o ku ha ere te tamatu i koe senie. Ki Pitania. Kene kau i hono whalanglangi i pia moe whai a hono whamo ni i mo tala au ne pōpuaki mo na whawhunga e ato a tonga kotoa i e ofa na e whakahoko i Pitania. O na o mai e ko uhinga e kuia e ko siaosi tupo uloaki. Ko i mau kato me Pitania me George. Pia ko mea ne mau e Charlotte, ko i Queen, ko i Queen Charlotte. Ko o mai kato pe uhinga ko ni me Pitania. O a oi pe ki whatunga ko ia pure anga, na e ohi kātoa mai pe ai ngahi ilo mo e ngahi poto, mo e anga o e whakalere whapure anga whakasivilaise. Na o mai kātoa pe Pitania ai uka e pare mia, pe au ki ai mo e ka whawhawhonga whalearea. Ko no anga i hano whotutu ko ia whanua tonga. O a oi pe ke o ange ai kau misinare na o ange pe me Pitania, na mo whele ngai ki Australia o ki tonga. O lave Maria i ki whanua ko tonga. Ko i ngahi tanumaki na e whai e pure anga Pitania. Me ha mo e who o a o ki o nau tui. O nau ofa whanua ki whanua ko i ni. Ko i ngahi na e pe tui o tonga o tatau pe ange ko Pitania. Kai malo o pito mo wha malo a pito he lava le rei tau polokalama. To e whakawhi e piki mo tolu. Ki polokalama ko ia tu site o wike kau. E mau toi tukat whaki ai ngai whakaikiki e te waki o whalau, pe o ma ai ngahi o ngō lahi pe aku o mai pe me to pre ama. Ma lo o pito mo mea mai, me to whao a kasi pe tai aho.
Sen puloka tātola.
Pe fo ke mau ensinia ko neta tua tā pe lava.
Sai tonga hiko, e o whalawa, e tāmesi, koe whai ana e whakaua.